Hi, my name is Whitney Lowe and I'd like to welcome you to the second DVD in my orthopedic massage series. The lower extremities are the limbs of locomotion, so they take quite a pounding from repetitive loads as well as other activities. Lower extremity pain and injury conditions are common in numerous occupational activities. Injuries result from repetitive motions, lifting, moving, or other mechanical challenges. Recreational activities also put stress loads on lower extremity tissues and can create biomechanical challenges that produce soft tissue pathologies. The soft tissues of the thigh, knee, leg, and foot can be overwhelmed from these loads, so massage therapy is a key treatment for orthopedic disorders affecting this region. Knee ligament injuries are relatively common, but the anterior and posterior cruciate ligaments are deep in the knee and therefore inaccessible to massage. The next 4 tests will help you be able to rule out injuries to these ligaments. The anterior drawer test evaluates the integrity of the anterior cruciate ligament. Clients showing signs of injury to these ligaments should be referred to an orthopedist. The anterior cruciate ligament, or ACL, is one of the most frequently injured tissues in acute knee injuries. It spans between the anterior aspect of the tibial plateau to the posterior side of the femur between the femoral condyles. The ACL's primary function is to prevent forward shifting of the tibia in relation to the femur. For example, when an individual suddenly stops when running or lands from a jump, there is a strong forward force on the tibia. The ACL's job is to absorb some of this force. Begin with your client in a supine position with the hip flexed and the knee flexed and the foot flat on the table. Anchor the client's foot underneath your thigh so it stabilizes the lower extremity. Place both hands behind the proximal end of the tibia with your fingertips and place your thumbs near the top edge of the tibial plateau. Once in this position, take up the slack in the muscles on the back side of the tibia and give a firm pull towards yourself and identify if there is any pain, mushy end feel, or forward movement of the tibia as you give that forward tug. Watch the top edge of the tibial plateau to see if there is any forward translation in this direction. It's not going to be a great deal if it is visible, but you'll feel the mushy end feel and you'll see a little bit of movement coming forward that way. If it does, this is indicative of potential injury to the anterior cruciate ligament. The primary function of the patella is to improve the quadriceps muscle's angle of pull on the tibia. During flexion and extension, it must move superiorly and inferiorly in the groove between the femoral condyles. Not all fibers of the quadriceps group blend directly into the patella. Many of them mesh with the patellar retinaculum, which is richly innervated. This retinacular tissue also helps transmit contraction forces to the tibia, so its role in knee extension is crucial. In addition to the strong ligaments around the knee, stability is aided on the lateral side by the iliotibial band and on the medial side by the 3 tendons of the pes anserine group.